Hi, I'm Andrea Ivory, your host of Living for Longevity, a podcast designed to help you live your best life, presented by the Women's Breast and Heart Initiative, a nonprofit organization that transforms and saves lives through disease prevention and early detection. Today, I am honored to introduce our distinguished guest, Amy Sear. Amy is board certified in Oriental medicine, teaches Oriental medicine at 3 Florida academic institutions, is a full-time acupuncturist at Memorial Healthcare System, Integrative Medicine Department, and participates in many other professional endeavors. And I don't know how she broke away, but I am so honored that she's joining us today. Amy, welcome and thank you for joining us.
Thank you.
Thank you for having the time and the patience to drive all the way through the traffic. We're happy to have you here. Well, Oriental medicine has been in existence for thousands of years. It is a holistic approach to health that emphasizes balance and harmony and the connectivity of the body, mind, and spirit. Today, we will discuss the rich
origins and traditions of Oriental medicine and how it can be beneficial. So, Amy, are you ready?
I'm ready.
Let's get to it. First, tell us more about yourself.
Well, thank you. So I'm a licensed acupuncturist here in the state of Florida. We have licensure since the early 80s. I've been licensed since 1997. I hail from Western New York, where I grew up and went to college. Spent a dozen years in Arizona, and shortly after I moved here to Florida, kind of by fluke, I kind of stumbled upon an acupuncture school, Oriental medicine / acupuncture school near me, a little bit of a fluke, and decided to sign up, almost thinking of it as a hobby, and was so enamored with the sophistication, the intellectuality. It was very deep, and one thing led to another, and a couple of years after graduating, I took the leap and left the previous industry and went full-time.
That's exciting, and that's literally what drew you. You just thought it was going to be a hobby. It was something to do, and now look at this. This has become your profession, and you've been able to help so many people. So there are many documented cases about the benefits of Oriental medicine, and with its origins in Asia, and Asia having some of the highest rates of life expectancy, anything that we can glean from the benefits of Oriental medicine, or even implementing some of its principles, can help us live our best lives. So now, Amy, just from your professional perspective, just the basics, please tell us what Oriental medicine is.
Well, to keep it simple, it's a full spectrum, top to bottom, right to left, diagnostic and treatment model. So, using Asian Taoist principles in medicine. Part of it is self-help, self-care, proper lifestyle, things we can all do by ourselves. Most of them people would recognize as common sense, but, not the way our culture lives now. Okay, and then the other side is like the professional, medical, treatment side of things, right? So Oriental medicine is the grand totality of acupuncture. We have all kinds of massage techniques, movement techniques, if you've ever heard of Tai Chi, Qigong, breathing, breath techniques. Quote unquote, Oriental medicine has a lot to say about like food and diet, like general things for everyone, and then specific things person to person. And then we have this sort of massive, of course, aspect of acupuncture, which of course is a professional treatment. Licensed here in Florida. Florida actually is one of the early adopters and one of the most comprehensive scopes of practice in the country. It's way up there in the top.
So how do each Well, if you could just restate what the components of acupuncture are, that probably will be helpful. If you can just give us one, two, three, four.
Of acupuncture.
No, of each of Oriental medicine.
Well, the number one, the parts you go to professionally would be acupuncture, massage. We have many massage techniques, herbs, and then lifestyle.
Wonderful. Well, how do each one of these components benefit us?
Well, let's go one by one. But in general, the goal, of course, right, is relaxation, what we call balancing out. I don't know if you're aware of the sympathetic versus the parasympathetic nervous system. Basically, the nervous system that gets jacked up when we get stressed out is supposed to calm down, be brief. But modern life kind of overdoes that. So acupuncture has already been identified as very, very well capable of balancing that out. So short-term relaxation, long-term relaxation, resetting certain circadian rhythms of sleep, daytime, all that, organ function. Of course, pain. Most people think we only do pain, but of course, pain. But all kinds of things in terms of digestion, sleep, neurological conditions, digestive. I think I said that. To keep it simple.
Yeah, thanks for that simplistic approach and dialogue. And, I know most people think of Oriental medicine, they go straight to acupuncture.
Yeah.
Okay, so why don't you demystify that for us a little bit? Tell us what acupuncture really is.
Well, it's a very simple technique. I'm sure people think it's sort of scary or intense or weird, but it's a simple technique that's been figured out. Don't ask me exactly how it works in the body, but we're super duper thin, medical, sterile, super thin, like hair thin, not like a hypodermic where you would get an injection, not like something blood draw or something like that, like infinitesimally smaller than that. Many of the needles I use are so thin they just bend all over the place, and that are inserted into certain sites that have been determined for hundreds, thousands of years to have be able to change medically things inside the system. And they're, it's especially in the United States, it's a regulated, licensed profession. So it's all, clean needles. We have all kinds of regulations for safety, cleanliness. You don't have to worry about that, and disposal of the needles. But anyway, it's a simple technique where locations in the body that, when they're utilized, have all these health-giving benefits.
So how does acupuncture work within us, and what are the principles behind it?
Well, the principles, which may or may not be easily understood because they're a little abstract, is that there are locations that are invisible, seemingly invisible otherwise, that have this affinity for different body parts, right? So here for digestion, here for the eyes, points down on the feet that activate anything in the lateral side of the head. So there's, it's very complicated how many different things, but we don't actually have one unified, singular, we figured out this is the one thing that happens when you use this thin needle. So we don't have that one, so I can't really connect that dot. But we know for sure it activates pain relieving chemicals in the brain, highly activating of relaxation, and that crazy sympathetic parasympathetic thing, which is very helpful in modern patients because that's usually an element that's going on. So, and it has a lot to do with the nervous system. Now, we're not targeting nerves. I want to make that clear because people think we're targeting a nerve and yowza, they're going to go through the ceiling. We're actually avoiding those kind of nerves, but we're using like the neural system, and somehow from here works over there. I know you want everyone, it's a great question, and a bunch of my patients want to know literally, how does poking that do this, and I can't connect those dots. There's a lot of research that's being done through interstitial, that empty water-filled space between cells. But that doesn't mean anything to, a person that might be watching this podcast.
So, what issues or conditions could and does acupuncture help with?
So basically, probably everything up to a certain point. You don't use us for emergencies. We don't treat like high-level disease, but anything in the realm of skin, pain, digestion, mood, sleep. I've treated people that had a bicycle accident and, scrapes and bruises, but nothing else, but lost their sense of taste. Seriously. And he was a cook, a chef. Oh, no. And he was like, and when you lose your sense of taste, you can't smell. So he was like, I don't know, but my wife said, you got to try Amy and acupuncture. Within a few treatments, he had his sense of taste back. So that's kind of, harder to explain in answer to your question, but almost anything. But the things that are the most common that come in my door that get a high level of relief, shingles pain, hot flashes, people going through oncological treatments, all kinds of migraine, headache, even of an unknown origin. I have patients that have had MRIs till the cows come home, quote, nothing, but, they have chronic headaches or 24/7, things like that. All kinds of digestive conditions. What else are kind of big? Of course, pain. Plantar fasciitis, we work with an awful lot. Of course, low back pain, neck and trapezius pain, all kinds of things. But theoretically, we have a model for almost anything. But in reality, you wouldn't come to us for an emergency. Or you would get all your Western information cleared, and then they're like, well, we don't have anything more for you, so then we can fill a spot. But you would never come to us and waste time not getting a diagnosis or imaging or emergency care.
So is there an occasion or a time when someone comes to get acupuncture for preventive reasons?
Sure. We call that wellness. Yeah, wellness. So prevention, of course, usually is you're presupposing, you're guessing something. So we call it more wellness overall. So the answer, of course, all the time. Of course, all the time. Now, if they want to come through insurance won't pay for, quote, wellness. And, nowadays, this year in particular, I've seen almost a 4-fold, maybe a 5-fold increase just from last year of people's insurance policies that now have coverage, okay? So that you could ask me about that if you want, but I just want to put a caveat. Insurance doesn't cover wellness, but lots and lots of people. I have many, many people. Something else, it's not really prevention, not exactly wellness, but maintenance care, right? Many, many people have whatever the problem is. It has a Western medical diagnosis or not. They've gone as far as they can with Western medicine treatments, and they still have, wedges of problems in there. So they come in for acupuncture and they get much better. Many of them like how they feel, one, overall, or if they go too long without acupuncture, problems start coming back. So that's not really prevention per se, that's more like maintenance, so lots of maintenance care. Fibromyalgia is another very, very common that, would fall under that. Maintenance care, long-term maintenance care.
Are there any side effects or potential risks associated with acupuncture?
So yes and no. So I don't call them side effects. Side effects sounds like a known potential negative new problem. So no to side effects. Quote risks, sure. You could have a teeny tiny amount of local bleeding. We're talking like the size of a sesame seed maybe. A person could bruise, does happen. Happens, once out of several hundred acupuncture points, small bruise in a local area. getting even less common, possible local sensitivity or numbness for a few hours or a few days. And then the worst case, of course, would be like an infection, or if somebody was practicing way off the rails, even theoretically they could poke your organs. But any ethical, licensed, reasonable person, that's not going to happen, which is why you go to a licensed, insured, trained, board certified practitioner. But essentially, we would say no. I always joke, it's just a joke, this is medicine that has good side effects. Because they come in, let's say, whatever, they come in for hot flashes, and they don't tell me I also have blank, blank, blank. And within 2 or 3 visits, the blank, blank, blank is getting better. So even though I'm choosing strategies for the person, their constitution, and the way their problem's manifesting, many things benefit. So that's what I mean. It's like even though we're targeting something, these acupuncture points really work really all over the place, all over the body. So, and people feel good. They love it.
I did. You were my first introduction to acupuncture, so thank you so very much. Can Oriental medicine be integrated with Western medicine?
It is being integrated. I work for the Memorial Integrative Medicine Department. So integration means like working together. Because you didn't ask me, but people are like, what does that word mean? Because it's not describing the technique. It's describing the concept. And it's essentially bringing older, effective techniques, quote, back into medicine. And proximity, right? So some integrative medicine departments like mine, we work closely together. Some departments you work across town. Some you're in private practice, but you work closely with surgeons, physicians, psychologists, things like that. So the answer is yes. It's growing leaps and bounds. The Veterans Administration is massively almost exploding with now what they've decided to do in the last few years is in-house acupuncturists. They went through a phase where they would pay insurance benefits for what was called, I don't know if you know what a community provider is in the VA system, right? Outside of a VA facility, but they've decided it worked so well that I think over 100 locations in the U.S. of the VA, growing all the time, are utilizing acupuncture. In the oncology world, all the large oncology centers, all the medium and even small oncology centers all have one form or another of many of these techniques going on. Memorial's had an official department that I've been an employee of where I'm a month from my 9-year anniversary. Wow. 10 years before that, 10 years before that, I was in close proximity, but not an employee. Medicare is currently covering acupuncture in a very limited basis. It's chronic low back pain with a lot of but ifs, but there is a bill up in the Capitol, the federal Capitol, to just change a few words enough to open it up more for more people beyond that. So absolutely, positively, all over the world and a lot in the United States. Fertility, acupuncture treatments is massive in the world of fertility and reproductive medicine. Many pain management departments. Oh, and Memorial just added a acupuncturist in the Joe DiMaggio pediatric area. Oh, for children. Oh, they've been doing acupuncture for children for years. I haven't, but it's been done. Yeah, it's a little different, Needles aren't retained. They don't sit still so well. You have to deal with the fact kids move around a lot. But, oh, absolutely. They do acupuncture on pets and animals. Veterinary acupuncture is very big.
Well, thank you for what you're doing for the veterans. Any type of relief that we can give them naturally is just, I'm sure, more beneficial to them than so thank you so very much for doing that. Well, how do you envision the future of Oriental medicine evolving, and what role do you see it playing in the future of healthcare?
Well, I covered a couple of those. Obviously, with full Medicare inclusion, and then eventually the first step is to get all acupuncturists able to provide the service. That's the glitch. I won't go into the politics of it. But right now, acupuncture's covered for documented chronic low back pain that has done other methods that have failed or not worked well enough. But there's some glitches about which acupuncturists, because we have to be supervised by a doctor. So I'm able to do that because I work with a doctor right in the office. So that's what we're working on. But then eventually it's inevitable more conditions than just chronic low back pain. So that's very large. That's nationwide, 60, 70, 80 million people. Absolutely more and more hospital systems, more and more group practices, much more research. Research is going up a lot. I don't know if it's still current, but the opioid situation really spiked. I'll bring it back down to Florida, even though I know all your guests and such like that are not all from Florida, but Florida, I would say maybe around 2018, passed a law that anyone that prescribed an opioid had to hand the patient this very specific document that told the patient all their non-opioid options. And acupuncture was, one of the modalities there. So that was I would say that's a big integrative bump. Right? And then a physician that, doesn't want to use opioids, but they want to help a patient, big, huge inclusion of, hey, please give acupuncture a try. And I think probably the biggest future is just a big jump this year, regular insurance policies, huge increase. I would say 4 to 6 times the amount of people this calendar year from last calendar year in regular level insurance policies. So I think those are some of the future. Sure. We have 3 states left in the country that need to gain licensure. That's the futures, to get 50 states licensure.
So, in other words, it's not available in every state in the United States.
Legally.
Legally. So
I'm not saying no one's doing acupuncture in those states, trained or untrained, but, the only way you prove competency is through licensure.
And what if you don't have health insurance and you want to engage in acupuncture? What do you do? Do you see uninsured patients that pay out of pocket or?
Sure. So, yes, of course, I still see a lot of people that pay out of pocket. Our system is a flat fee. Everybody's office is different. You have schools of acupuncture that have clinics in the school. It's a different treatment thing. You give up certain things. You're not always going to see the same practitioner, and they are students, and there's a lot more moving parts, but those can be less expensive. Back to veterans, many of my peers will have certain evenings of the month free for returning vets. Many charitable institutions have people going in volunteering. Again, it's a little more elementary type treatment. But yes, out of pocket. Yes, there's all kinds of charitable organizations around the country growing. That's what I would say.
That makes it more accessible.
Absolutely. Oh, one other thing about accessible, there is a type of acupuncture called community acupuncture. Have you ever heard of that? No, I have not. So the word is community. It's essentially an open room with multiple, usually in a chair, not a table. So multiple people per room per hour. So one clinician is able to treat, instead of one-on-one, multiple per hour, which brings the cost down. Sometimes that's specific to just like, let's say, addiction. It's all in an addiction program. Sometimes it's not condition specific. But that's another access point that can lower the cost and make it
affordable.
more affordable, more doable. Now, it's a different experience. You're not laying on a table in a private room. You're more in a chair. So, some of the acupuncture points aren't accessible, but the VA's been doing this for years. There's all kinds of charitable organizations that just sit people in stiff chairs and use only one ear after like natural disasters and stuff. There are a lot of different styles. So, lots of access.
Is there any type of acupuncture that is used where you just mentioned the ear? And I've seen some people that have a little stud in their ear. Is that acupuncture?
Well, it depends. So it's not really acupuncture because you're not puncturing with a needle. We do that in the office, right? An actual needle, but it's removed. But we use these little adhesive things that have either a little seed from nature, SEED, seed, that's pressed there and stays there. I've used ones that are more like a metal pellet, right? That's a little smaller, not so visible. And then the person squeezes it several times a day and takes them off, or they fall off in a couple days. So as long as that's what you mean, so it's not really acupuncture, but it's utilizing the exact same points, different stimulation, a little bit different therapeutic action, but it's more enduring, right? The person can squeeze them and activate them themselves a couple times a day. Safe, you don't have to worry about an infection because it's not breaking the skin. So it's same principles, different tool.
This is very thought-provoking. So, is there any advice that you can share with our audience that can help make a difference in their lives as it relates to Oriental medicine?
Sure. Well, one, if you're at all on the fence, just jump in, or call around and get a comfort zone. But I would say a very high percentage of my patients, I've been licensed now 27 years, once they come in that first day, they're like, oh my goodness, I should have done this years ago. I've been carrying your card around for years. I was afraid. I thought it was this. I thought it was that, whatever. Okay. So, like if you're on the fence, just do it. Two, there's a lot of self-help topics within quote unquote Oriental medicine, self-care that you could certainly adopt. There's some very good books out there that are very helpful in that. I have mixed feelings about some of the stuff on the internet because some of it is untrained people that are just perky personalities called an influencer, and people think that that's legitimate information, and maybe it is, maybe it isn't. But there's also very good quality stuff on the internet. And a lot of that, many of these techniques you can do yourself, right? You can learn Qigong is a movement technique. You can absolutely learn yourself. It's great if you can go to a live class, but you don't need a live class. Same thing with Tai Chi. There's tremendous information about sleep, lifestyle, foods, seasonal foods, time of day foods, the quote-unquote Chinese medicine, Oriental medicine, attributes of banana versus tomato versus apple. They all have different attributes, so you can learn those.
That's exciting.
Yeah.
That's pretty exciting.
And then some of it you can use in conjunction with your acupuncture, saying, hey, you should use foods that are more blood nourishing, or you should eat more foods that are more warming, less cooling. And then, of course, you use the resources to figure that out. But I would say, if you're interested in acupuncture, just go ahead and give it a try. Find a licensed, nationally board certified acupuncturist. I don't know if your podcast allows some resources. I'm happy to give you some websites on how they can nationally find people that are board certified.
Why don't you share that information?
So it's it's the National Certification Commission for Acupuncture and Oriental Medicine. So NCCAOM, probably.org. Maybe .com, but probably .org. National Certification Commission for Acupuncture and Oriental Medicine. So that's a board certification 50 states wide. So that's a helpful tool, right? With credentials, and you can see if they've ever had discipline trouble or anything like that. Other than that, there's a lot of very high-level resource materials. Reach out to a local acupuncturist and also find someone that can teach you some of this self-help, self things.
Thank you so very much.
You're welcome.
This has been very informative, and I'm sure our audience will be able to glean something that can help them in the future and even today. And so always, I like to close each episode with gratitude. And I'd first like to thank my production team. They are amazing. They come together and somehow they make it all possible. You haven't had a chance to witness that.
Yes, I have. I'm impressed. I'm impressed.
Thank you. But there's one that I'd like to mention specifically. It's Moritz Acosta. He is a high school student. We talked a little bit about him. He's actually one of the reasons that we are sitting here today. He has his own nonprofit organization, which is focused on civic engagement and preparing the next generation of leaders to lead our country. He's doing amazing things here locally, across the state, and in Washington, D.C. Remember his name. He is a rising star. And then to the town of Miami Lakes Mayor, Manny Sid. Thank you so very much for opening your heart, your office, the podcast studio in your office to host the Living for Longevity podcast. We appreciate your support. And to our special guest, our esteemed guest, Amy Sear. Please, thank you. First of all, thank you so much. You drove very far to get here, and you're going to drive to your next meeting. So thank you for your time. Listen, please keep practicing. Keep teaching. We need you. Keep serving and keep living your best life. I'm your host, Andrea Ivory. Thank you for joining us. Please tune in next month for another episode of Living for Longevity, a podcast designed to help you live your best life. Featured will be stories of triumph over tragedy, lifestyle experts, strategies to help you live a disease-deterrent lifestyle, and resources to guide you along the way so that you can live your best life and enjoy more time with family and friends doing the things that you love to do. Please subscribe to the Living for Longevity podcast, and we're social. You can visit us on Facebook and YouTube at the WBHI, or on Instagram and X at WBHI. Also visit us on the website at flbreasthealth.com, where you can find resources to help you in your daily walk. Thank you so very much for joining us, and until next time, live your best life.